When I filmed these sequences in Phnom Penh in the spring of 1998, Cambodia had just come out of civil war and the killing field. Then a new danger hit the country, HIV and AIDS. 1998 was the peak of the Cambodian AIDS epidemic. HIV spread out of control in the country, and the efforts to halt the epidemic had just started.
I think the women have an education session in the market like this is very important because people start aware about HIV/AIDS. And right now in Cambodia, HIV/AIDS is very fast epidemic. And although, especially among the youth and people around 18 to 35, it's high-risk group.
40% of the commercial sex workers, 7% of the police and military were infected, and 3% of the pregnant women were infected. Cambodia had one of the highest infection rates among the countries in Southeast Asia.
If Cambodian people doesn't have any scheme for prevention on HIV/AIDS epidemic right now, we will have another second killing field to our people.
When I first met the social worker Sopip in 1998, he was a passionate young AIDS activist. He worked at the World Vision Project in Phnom Penh, one of the earliest organizations to address the growing AIDS epidemic in Cambodia.
Through working with the AIDS patient here in Phnom Penh, especially in the poor community, make us change a lot. The way we think, it change a lot because we see the real need of community people, which a lot of things that we have to do for them. When we think about the inequality between the rich and the poor world, I feel very angry because in the rich country, they spend $25,000 per year for one AIDS patient. And here in Phnom Penh, we have only $10, even less than $10 for an AIDS patient per year. So it's not fair to people here in Phnom Penh.
Today, Sopip is Executive Director of CANA, Cambodia's largest NGO on HIV and AIDS. It is instrumental in developing the country's response to HIV. So, today, 16 years later, what do you say today?
Today, I think people are very happy. If you look at the face of people with HIV, they're smiling, they're talking, they are actually just like everyone else in the communities. They continue doing their life, doing everything in their life just like many other community members. But if you compare to 16 years ago, it was horrible. A lot of stigma, discrimination, and perhaps being HIV positive almost like a death sentence because, as I mentioned, 16 years ago, AOV was just our dream. There's no hope.
When I did this interview in 1998, you were angry because Cambodia had no antiretroviral medication, only the rich countries. How did this change?
I think it took us some time from 1998 to 2002 before we could get more people on treatment for AOV. So since then, we keep scaling up and up again. So every year we put more and more people on AOV. And now I think we become one of the successful countries in the region to put people with HIV on treatment, perhaps in the largest number, almost 80%.
Cambodia's success story on treatment was made possible through a national HIV and AIDS strategy. Free access to ARV treatment was funded by developed countries such as United States, United Kingdom, France, Australia, and others, along with UN agencies and the Global Fund to fight AIDS, tuberculosis, and malaria. Let's go back and look at some highlights from the early years of Kana.
Today, Kana is working various projects fighting against HIV/AIDS epidemic in Cambodia by strengthening the capacity of NGO CBO to develop appropriate response to HIV and AIDS. Kana have 40 local partners working in 14 provinces and 2 municipalities in Cambodia. In terms of partnership, Kana have provided them technical support as well as small grant to implement activity at community level. We have different projects of HIV/AIDS such as prevention, HIV/AIDS prevention, which is targeting a wide range of more vulnerable groups such as young people.
Here Umsupip from Kana is preparing a peer educator, Vanette, in prevention work targeting high school students.
This is Batuk, one of the biggest high school in Phnom Penh, where many teenagers have their class here. In Cambodia, now a lot of teenagers, young people get infected with HIV. And what we can do to help them, to provide education to them, to increase access to information for them so that they can know how to protect themselves from HIV/AIDS.
These are images from Kana's 4th youth camp in 2004. The youth camp attracted young peer educators from all over Cambodia. They came together for a week in Siem Reap and exchanged views as well as participated in sessions with people living with HIV and AIDS. The Kana youth camps, organized regularly, has an important role in developing a new generation of peer educators to be engaged in the prevention of HIV among young people.
Yop ni dung chan 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 rang smay chom like Thom chit ko plai ko pi thom da chum no bong mo kro.
I think from the beginning we always involve people with HIV/AIDS, and I think part of the success story is the involvement and the participation of people living with HIV/AIDS.
In the evening, we have 2 teams to do outreach for men have sex with men in Phnom Penh. We teach them how to be strong, how to have safe sex, and how to take care of themselves.
Many of these young boys would be selling sex because there's an economic imperative. They're poor, they have very few employment opportunities, and so they're pushed to selling sex.
Before, men have sex with men in Cambodia were hidden, but now they come open, and that's very important to fight HIV and AIDS.
I think luckily Cambodia is one of the fortunate countries where we have a strong political support from our top governments, and Prime Minister himself, has been involved in many occasions publicly about the response to HIV/AIDS.
Of course, I think it's absolutely very, very, very important to empower the women in Cambodia. Yeah, if we want to fight against HIV/AIDS, and if we want to have a strong voice of the women.
What are you doing here today?
I just come out here to check out with the home care team. They on day-to-day basis they come every day, go out and visit patients at home. And so once in a while I just want to come out and see how things works here and try to support them sometimes on the spot. This patient, 1 year ago, before the home care team met him, he was dying and desperate and looking for help. And fortunately, the home care team found him out and found him here and referred him to the hospital. He got a treatment right away, and now a year later he can walk. I think a lot of improvement in his health.
បាទអត់ខ្ញុំវាមានអារម្មណ៍មួយយ៉ាងដែរប៉ុន្តែដូចទីថាมันមានគេអ្នកមាក់ងាយទេគាត់ថាមានការរើសអើងច្រើនខ្ញុំបាត់មិត្តភ័ក្តិច្រើនណាស់ដែលគេដឹងបាទដល់ពេលខ្ញុំប្រាប់គេត្រង់គេដឹងកាលដំបូងហ្នឹងបាទកាលដំបូងហ្នឹងដែរខ្ញុំទៅបាត់មិត្តភ័ក្តិច្រើនណាស់បាទសូម្បីថាគេរើសអើងហើយខ្ញុំក៏មិនស្អីទៅក្បែរគេដែរអ្នកខ្លះក៏គេរើសអ្នកខ្លះក៏គេរើសបាទ
Stigma, I think a lot of change in this too. I think it used to be very difficult for the home care team to come out to the community and visit the patient at home. People didn't talk any good thing about AIDS at all at that time. But now, it's very open. Everyone knows, and everyone just think it's just a chronic disease. And we have specific treatment for them, and they can help. And so everyone knows, and the home care team is smiling with the patient, and the patient is welcoming them to come to their place. Now it's okay. I think with treatment, people can get many other things after they get their health back.
I would like to change the relationship between the man and the woman in this country, because sometimes I can see the gap between the power, men at this level and women at this level. That's why like a woman, they still like become poorer and poorer. Here is the income generation activity project for women living with HIV, and I think it's very important because we can bring the women together. It is very important to have a job for women living with HIV, because if they go to work outside, they cannot find a job. If they knew their HIV status, then they might discriminate them. So we are here to be as a family.
Angkor Hospital for Children has a special clinic for children who were born with HIV. 10 years ago, these children died, but today they get free access to treatment.
So far, we have 564 children in the program, and in this amount, there are 521 are on ARV medication.
Srey is 13 years old and makes his visit to the clinic every month. We have chosen not to show his face because he is a minor. Dalish Prum, 28 years old, has been an HIV activist for 5 years. She was diagnosed at the age of 18. She now focuses her energy to empower women living with HIV.
I'm Dalish, and I am an activist for HIV. Why I am here for HIV activist? Because I'm also HIV positive, so I think that it is very important to be involved and have people living with HIV, especially for the women living with HIV, in order to improve their health condition, and especially I really want them to speak up and to bring their voice.
Did you disclose your status and become open, or did you keep it secret?
No, I keep it secret. Yes.
Wow.
Because I feel afraid of disclose HIV status as when I was 18 years old. Discrimination and stigma is very high among people living with HIV. I do not want to live anymore. Yes, because HIV status, because of I was young, because I think maybe I cannot marry it or I cannot continue my life. Today, I'm very healthy and I'm married, and I also work for people living with HIV.
Dalish often makes outreach visits in her work. Here she visits a group of sex workers living with HIV outside the capital, Phnom Penh.
I'm now visiting sex worker group, and they are explaining me about the difficulties nowadays. I teach them about HIV infection and how to use condom and sexual and reproductive health, and also leadership as well. It is difficult to be a sex worker in Cambodia because it is illegal. I'm very happy to meet them because they are very popular with me. And we are like one family when we meet. Yes.
Together.
Yes, we are very close. Yes.
ហើយបើសិនជាគាត់អត់ប្រើសូមទេគឺយើងអត់រួមភេទតែម្ដងដើម្បីជៀសវាងការចម្លងទៅអ្នកដទៃ
Okay, we don't disclose our HIV status to the client, but we have to ask the client that you have to use condom in order to prevent HIV or STI transmission. If they don't use, we will deny to sleep with them.
អញ្ចឹងអរគុណហើយបងខ្ញុំលាទាំងអស់គ្នាជំរាបលាបងហ្នឹងហើយចា
I become HIV activist because I really love this work, and I believe that I can help other people living with HIV, especially for the women living with HIV. And I believe that I am a role model for them, even I am young, but I believe that I can help them.
MSM, Men Who Have Sex with Men, is a key group to reach in the Cambodian HIV response. Here is a newly opened social club for young Cambodian MSM in the city of Siem Reap. It is a meeting place providing counseling, testing and support.
ដើម្បីកុំឲ្យមានការរើសអើងចំពោះក្រុមដែលស្រឡាញ់ភេទដូចគ្នាហើយឲ្យគាត់យល់ដឹងពីសេវាសុខភាពទាក់ទងនឹងមេរោគអេដនិងជំងឺអេដហើយនិងជំងឺកាមរោគចំពោះខ្ញុំការកាត់របស់ខ្ញុំគំនិតរបស់ខ្ញុំក្នុងក្លឹបសិស្សស្រស់នេះគឺថាគេបង្កើតមកគឺល្អហ្មងសម្រាប់ផ្ដល់ឲ្យយើងកន្លែងធ្វើតេស្តជាម្ដងល្អហើយគេផ្ដល់សេវាយើងជារៀងរាល់ពេលរាល់លើកហ្មងហើយមានកម្មវិធីអ្វីក៏សប្បាយដែរគេជឿចិត្ត
Votea is a 23-year-old MSM who works in a bar nighttime. At the club, he takes his HIV test once a month. So far, he has succeeded in remaining negative. At the AB bar in Siem Reap, Votea and his young friends dress up as ladyboys for the night.
ពេលដែលខ្ញុំផ្លាស់សម្លៀកបំពាក់ជាបុរសមកជាស្ត្រីខ្ញុំមានអារម្មណ៍ថាធម្មតាព្រោះថានេះគឺជាមុខរបររបស់ខ្ញុំសម្រាប់រាល់ថ្ងៃថ្ងៃអនាគតរបស់ខ្ញុំនឹងចូលធ្វើបែបនេះព្រោះខ្ញុំនឹងរកការងារមួយប្រកបធ្វើហើយបើមានរបរអីមួយខ្ញុំនឹងធ្វើវាខ្ញុំនឹងចូលធ្វើចេះ
Another key group to reach in the HIV response are the intravenous drug users. This Kana-supported project visits drug users outside Phnom Penh every day.
Here is the slum area in Chaba district. In Phnom Penh, yeah. There are a lot of drug users gathering here, especially for the community. Yeah. We will meet him at the house. Their resident.
Your result is good?
Yeah, I think very good. The result. To make him or her are on methadone. We are so happy to work with him or her, especially when we found him or her to change their behavior, attitude. They reduce the drug use and they start to access the health service. This group is a methadone patient. Our project pick up them every morning to methadone clinic. Because they are so poor, they live in slum area. They don't have any transport support for daily basic to access to methadone. So we need to pick up them in order to maintain them at methadone. This is the clinic methadone. NGO who are working with drug users always bring or pick up the methadone patient to methadone clinic every day. They can improve their life. They can support their family. They can go to earn the money to as usual. It means that they can they improve the status, the health status than before.
ខ្ញុំមកពីមានអង្គការជួយខ្ញុំទៅផឹកជូនទៅផឹកថ្នាំហើយជូនទៅវិញទៅមកលេងរឿងមេអីហើយខ្ញុំផឹកថ្នាំហើយអត់ឲ្យខ្ញុំចាក់ទៀតទេឲ្យមានអារម្មណ៍ចាក់ទៀត
The methadone clinic in Cambodia we started in July 2010 and until now we enrolled about 260 clients already. And every day we got about 140 clients, come to get the methadone dose, daily. And based on our, record, we can see that most of them, they can reduce injecting, drug use, in the society.
I think in Cambodia we can end HIV. We already have a clear strategy and roadmap to end HIV by 2020. We'll continue working together based on all the experience and good lessons learned from the past 15 years, and we innovate more to reach out to most of the population to get them come forward for testing. And if they test it positive, we try to make sure they get the treatment as soon as possible and continue staying on the treatment.
I will continue to work as an HIV activist in Cambodia until HIV will be finished in the world.